Hello, welcome to our facilities. I am a cranial nerve doctor, I am the cranial nerve doctor who will be performing on you today. My name is Dr. Rab. So, you're here to remove 4 teeth, yeah? And to learn how to use our new mega toothbrush. Yep. Have you ever removed teeth before? You have not? And which teeth are they? Those ones? The ones that are connected to all your nerves? That's not good. We'll have to do some nerve testing afterwards. I guess that's why they called in me the cranial nerve dentist specialist. So, yeah, we will remove your teeth, brush your gums a little bit, and then we will check your nerves just to see that you're still functioning correctly as a human being and not a dragon who's going to get a visit from the tooth fairy. Yeah. Okay, so we will start with just some examination. Let me just put on my gloves here. Okay. Okay. So I will start by just looking into your mouth here. So just say ah and open it as big as you can. As wide as well. Maybe stretch them. No, I'm just kidding. Okay, so I'm just gonna have a look here. In your mouth. Okay. Okay. I have some tools as well that I'm just gonna be poking and prying, I guess, in your mouth with. So I'm just gonna look here, see what's going on. I can see that your gums are a bit inflamed. Do you use a normal toothbrush? You do. And that's why you want to use the MAXI toothbrush. Yeah, that makes sense. It is quite large, which means that it takes some time getting used to, but we'll get to that just as soon as I'm done here, okay? You know, even though I feel like I am just ready to start yanking those teeth out, I would like to just have an x-ray done first on you. And this is my sophisticated x-ray machine. So we're just gonna... Okay, and we'll also do one on this side. This one is such a good tool because it doesn't give me any x-rays bouncing back. So, okay. And it's also quite nice because the paint or the picture comes quite quickly. So you can see here, this is an x-ray of one of the teeth we will be removing. And you can see the dark spots here. These dark spots are the cavities, and that's why we're forcing to remove them, okay? This little bright light up here, it's your nerve endings. So the nerves travel via Bluetooth from your teeth to the nerve ending, and then it's not actually Bluetooth, it's kind of like Bluetooth. It's just easier to use these words, I think. And then it travels all the way up to your brain, and it lets you know that, ouchie, I had a boo-boo, okay? So, speaking of ouchies, I'm gonna give you some sedatives. It's this blue sedative that you just bite into and your entire mouth will just turn numb. So just open wide and then bite down into this and try to rip it out of my hands just to get all the chemicals working. Okay, good. Yeah. Okay, good job. Nice strong teeth. It's a shame we'll have to remove 4 of them, but what can you do? Okay. So, I usually would use like a tongue, but I seem to have misplaced it. So I'm just gonna go straight in there with my fingers. Okay. So open wide. Maybe close your eyes, just because this can be a strange sight. I will go digging into your mouth with my entire hands, maybe both, and just kind of crawl in there. Yeah. So we're going in here, and we'll just rip that tooth straight out of there. Look at that. Not a very nice sight, is it? No. We'll just throw this into the garbage because we don't need that anymore. Unless you happen to be the tooth fairy and you're looking to get some free teeth. And yeah, here's the other tooth. Just 2 more, and then we'll be done with inside your mouth. Okay, so I'll just. This one is a bit stuck, so just let me get both of them. Just kind of wrestle it out. Just like, do we have it? Yeah. Great. There we go. Next brush. They are quite big. They are indeed. So they use up a lot of toothpaste, and it requires a particular toothpaste to work, and it is these MAXI toothpaste. So you just squirt a large amount. You know how to say just a pea size? It doesn't count for these, so just fill the entire plate. And we'll go in and just do some brushing. So you just want to work it from side to side. It takes up a large area, so you don't really need to worry about going to the sides or anything. Just move it back and forth. And also on this side here, it's okay if it comes on your lips as well. That's just a bit of exfoliation, so you have soft and supple lips after you're done brushing. Okay. Okay, so and the toothpaste is safe to swallow. In fact, it is recommended. So just gulp that down, okay? Now, we have been working on some pretty special teeth, and that can, of course, lead to some nerve damage, and we want to make sure that's not the case. So I'm going to be reusing my dentist tools to just poke and pry at your face, and I want to know if it hurts. If it hurts, that's good. If it hurts, I'll just do it a little bit harder. If that still doesn't hurt, that's bad, and we will probably have to do something about it, but we'll cross that bridge when we get there, okay? So I will start on your nose. So this one is a bit pointier than this one. Actually, no, that's the opposite. This one was less pointy than this one. I felt it on my fingers. This one almost hurt. So if you feel a little stab, it's this one. And if you feel a big stab, it's this one, okay? Let me just get a better position so I don't fall forward into the patient. That is you. So just tell me which one you feel, okay? And it hurts. Good. I'll do the same thing on this side. And it hurts as well. Yeah, it hurts a lot. My name is Dr. Rav. Rav is my name. I'm also called William, or in my country we say William. Both are my first names, or my given name. No, not my given names. William is my given name, but then I was drunk once and I had another name attached to it, which is Rav. It means fox in Swedish. So I have a given name and a drunk name, but we shouldn't forget about this procedure here. It will be a bad dentist, a cranial nerve exam dentist, if I forgot about the nerve exam part. Let me just press here with my fingers. It's gonna be soft. It's not gonna be painful. If it's painful, let me know. Sounds like I'm typing on a keyboard, but your face is not a keyboard, I swear. I think so, okay. Okay, so now I'm gonna do your lips. They might be a bit numb after the MAXI brush. MAXI brushing, this one. Okay, so it might not feel. I might have to stab a little bit harder, but just let me know if you feel anything. Okay. So I'm just stabbing into your lips right now. I can tell that they're quite numb. But hopefully you're feeling something. Yeah, a little bit. Not very painful though. And that's not good. Maybe we'll have to do something about that, but not today. We'll have to schedule an appointment for that. Okay. So, you're having some difficulties with the pain receptors in your lips. Maybe I exfoliate a little bit too much. Sleep on it. And if tomorrow it's the same, you're feeling numb, if someone stabs you with a fork, it doesn't hurt. Book another appointment with another doctor. That's the best course of action, in my opinion. So yeah. Yeah, just sleep on it. It'll be fine, I'm sure. Sleep helps with everything. Okay? Yeah. Okay. Bye.